The greatest thing about caring for kids is that you don't just save a life, you save a lifetime.
Children are not miniature adults. They face unique health risks: fetal distress, infant lung collapse, childhood infections. But one children's hospital not only treats those risks, it is ending them. UCSF Children's Hospital.
We have a long history of being the place that invented the techniques that are now used worldwide.
We created the field of fetal surgery and the lung coating that prevents infant lung collapse, the first newborn intensive care unit. And now UCSF plans a bold step to advance children's health care even further. A 21st century children's hospital at Mission Bay, a powerhouse of discovery and care.
You? Did you win?
Yes.
Okay, one more time.
When George and Mia Boggs play yard ball with their daughter Sydney, Sydney gets way more hugs than hoops, and no wonder. When she was 4 months pregnant, Mia Boggs learned her fetus had a tumor as big as the baby itself. To save the fetus, Mia's doctor in the East Bay recommended UCSF Children's Hospital and Michael Harrison. He pioneered fetal surgery, operating on fetuses while still in the womb.
I'd have to think about it to come up with it.
After consulting his team of 24 specialists, Dr. Harrison decided to operate before birth. He drained the tumor, removed it, and safely delivered baby girl Sydney.
The nurses just wrapped the blankets around her and, passed her to me, and it was great. I was able to hold my bundle of joy.
The fetal program could never have flourished without a great university, hospital, and medical school like UCSF. It just can't be done elsewhere.
The excellence at UCSF Children's Hospital starts with over 150 world-class caregivers and scientists, all working hand in hand in every specialty imaginable.
So did you take an airplane to come today, McKenna?
People like Kate Mathey, physician and scientist. She offers new cancer treatments drawn from her own research, and she leads a national group conducting clinical trials for better treatments.
We've improved the overall survival from 10% in the 1960s to the point where 80% of all comers with pediatric or childhood cancers are now survivors.
Steve Gittleman, diabetes researcher and ranked one of America's best doctors, meaning his patients get everything from new therapies to life-changing insulin pumps.
Life with the pump it's like a lot easier. I can go to sleepovers, I can do things that my mom doesn't have to worry about me as much.
All the programs that we've gotten from UCSF and the treatment we've gotten from UCSF has just really helped us to gain independence for her. I feel like my butterfly has her wings and she's flying on her own.
Gianna and her mom came all the way from Modesto for the exceptional care at UCSF, and they're not alone. Sydney's family was referred by their physician in the East Bay. Little Rhett came from the Central Valley, and McKenna flew from Las Vegas. In fact, today, the extraordinary care provided by UCSF Children's Hospital attracts families from across Northern California, across the nation, and beyond. Tens of thousands of children whose families are seeking world-class care.
Our reputation for providing world-class care for the most complex medical conditions has made UCSF the place where other hospitals and physicians refer their patients. UCSF is an extraordinary resource for healthcare every single day for people here and around the globe.
The best children's hospital combines discovery and care, and something else. At UCSF Children's Hospital, we provide family-centered care. A child's family gets the space to stay overnight, and we involve them in the caregiving and decision-making. To treat the whole child, we provide activity centers and tutors to help keep up with schoolwork and special visitors. Our walls tell children they're welcome. Our caregivers show them they're loved. Today, UCSF Children's Hospital is one of the nation's leading hospitals, but has outgrown its outdated space on the Parnassus campus. And so UCSF plans not just a replacement facility, but one that will advance children's health worldwide. This is the site of a new UCSF Medical Center to be built at Mission Bay, just south of downtown San Francisco. The center will include a new UCSF Children's Hospital, as well as hospitals for women and cancer, resulting in seamless care for maternity and childhood cancer cases. The 3 hospitals will be across from UCSF's Mission Bay Research Campus, creating breathtaking possibilities.
What's really exciting to me is hearing people around here talk about the next generation of discoveries. They're imagining a future without birth defects, without childhood cancers.
The new Children's Hospital will have 183 beds devoted to pediatric urgent, primary, and specialty care, and the city's only pediatric emergency room staffed by actual pediatric specialists. The eye-catching entrance will have kaleidoscopic windows and whimsical colors, and this hospital will meet green standards. Sun-filled patient rooms will have views and family sleeping space, multimedia, sterile patient-only sinks, and nearby kitchenettes. Exam and treatment rooms will also be colorful and scaled to child size. Our Child Life Services will include an expanded and improved children's schoolroom staffed by certified teachers, playrooms and fresh air spaces, and atrium performances by local musicians and actors. The UCSF Children's Hospital at Mission Bay is an historic opportunity, but it will take extraordinary community support, your support.
Children are the future for all of us. Investing in healthy children is an investment in a healthy future for us all.
And that's why I want to do this project. I want everyone to say, I'm going to San Francisco for my medical care.
For all of the children who will someday need care, we all need to contribute to this project and do it now.
Our beloved daughter Annika was diagnosed with cancer when she was just 2.5 years old. The expert team of doctors and nurses at UCSF Children's Hospital did all they could to assure us that Annika would be a survivor.
At UCSF, we knew that she was receiving the best medical treatment available anywhere, and we received so much more. The staff at UCSF worked tirelessly to keep her comfortable and her spirits high. They also provided support for our entire family, and for that, we will be forever grateful.
Because UCSF gave us the hope and support to keep fighting, we started the Annika Kelly Strain Foundation in our daughter's memory. We want other children with pediatric cancer and other life-threatening diseases to get the same loving care and access to the programs that make their stay at UCSF as tolerable and enjoyable as possible.
That's why we're supporting the new UCSF Children's Hospital at Mission Bay, and so should you. UCSF is a place of hope for children and adults. They treat illnesses that other places simply cannot, and someday, any one of us may need that level of care.
Building a new hospital is an expensive proposition, but it is something that is so essential for all of us. A new children's hospital will not only care for the sick children of our community, but it will also help the gifted people who work there save lives.